We are totally inequipped to take care of our aging population. We are just in a really, really scary place in America right now in terms of healthcare.
Who's going to care for our seniors? And if our younger generation doesn't step up, what's going to happen? I mean, this is a big issue.
Our healthcare system is totally fragmented. We want our older adults to live with dignity and independence and have a quality of life for as long as possible.
Welcome to Spotlight. This is our very first episode. We're so happy you're here. I have a special guest today. But before we get into that, I want you to know why we're here. We're here to serve the senior world, to educate professionals, adult children. That's what we call them. They're children of mature people, our seniors, our geriatric realm. And we're here to also serve seniors, right? To educate, uplift, and to empower individuals with all things in the senior realm. So thank you. I want to invite Lorna Van Ackeren. Thank you so much for being here. Welcome to our very first Spotlight.
Well, thank you for inviting me, Athena, to join you today. Thank you.
Absolutely. Lorna, before we dive into today's topics, there's so much happening in the world of seniors. We have, what is it, like 11,000 plus a day retiring, our baby boomer generation, right? Everybody retiring. So there's this huge shift in our world, and people like yourself are so vital to senior care, just all the needs out there. And your background is pretty amazing. The education, the knowledge, experience that you carry, which is why I'm so happy to have you here today. Can you tell us a little bit about what you do and your background?
Absolutely. I'm a certified geriatric care advisor, but my background is in social welfare and gerontology and a master's in public administration and then certification for geriatric care management. But I'm very active in the senior community and resources that are available in all communities across the country. Here in Contra Costa County, I serve on the Advisory Council on Aging, the Board of Directors for Meals on Wheels and Choice in Aging, and also a commissioner for one of our local towns, Pleasant Hill, a commissioner on aging. And I share all that to let you know that there are a lot of resources in everybody's community. It's just a matter of tapping into them. From my employment history, I worked for the California Department of Aging, developing programs and administering money through the Older Americans Act. Then I also went into leadership roles in home care and then hospice. And now I'm a certified geriatric care manager. So I've kind of traveled throughout my life aging in America.
Geez, look at that history, all that experience. And we're so lucky to have you right here in the East Bay area. I have you right in my backyard, basically, where we can call on you for all of our needs in our senior living communities, which is wonderful. Can you give me a little bit of an overview? What is happening today in our aging population? I mean, you are everywhere. You have all these connections. You're in all these groups. What's going on, Lorna?
Well, the population of 65 and over in America is about 17%. In the next 5 years, it'll be about 23%. And that means right now we have 60 million people, 65 and over. In 5 years, it'll be about 73 million. So we have a huge population of older people. And if you look at that on the trajectory, 0 to 17 years old is 22%. So we have a very aging population and we have a very younger population. So there's a lot of financial strain in that middle group to support both these generations. And I think that there's huge challenges that we face in terms of providing for our older adults. And as aging children who are trying to prepare and lead their life, we're challenged in taking care of our older adults. I want to talk with you as we go through this about the different challenges and strategies. that we can use to help our people age in place safely, wherever that is, be it in their family home, be it in an assisted living environment. We want our older adults to live with dignity and independence and have a quality of life for as long as possible.
Yeah, and that's the goal, right? We want every person to have dignity, to have the respect that they deserve, to get the care that they need.
Mhm.
But you brought up a really big issue, and you went over these stats where there's like this huge number of seniors, boomers that are we're aging, we're all aging, right? And then you've got a lower number and percentage of younger
Right.
people, which to me brings up a little bit of an alarming situation. Who's going to care for our seniors? And if our younger generation doesn't step up, then what's going to happen? I mean, this is a big issue, right?
It's a huge issue, and it's a workforce issue.
Mhm.
We need to understand what's happening in America. Our healthcare system is totally fragmented, and I hate to do statistics, but here's my last statistic, I promise. Okay, if you look at geriatricians and pediatrics. We don't have a hospital for gerontology, but we have children's hospitals all over the nation. We have like about, I think, 7,300 actually certified gerontologists today in America, compared to 63,000 pediatricians. So we are totally inequipped to take care of our aging population um, from a healthcare standpoint, and
Absolutely.
and then from the work shortage standpoint, in terms of getting qualified home care people, qualified technicians. We are just in a really scary place in America right now in terms of healthcare.
It's so true. I don't think that adult children, again, like these are the children of our senior population. I don't think that they realize, if you're not in this industry, how big of an issue this is. You know, I was talking to my father, I think it was just yesterday or the day before. He's 74 years old from Hawaii. And he was telling me how frustrated he is with the healthcare system and how he gave up getting support for a colonoscopy for a lump that's in his arm that he was told could spread and become a really big issue, and for mobility from a pulled muscle. He said he went to the doctor and it had been 2 months since he had seen a doctor. They haven't given him test results, and he needed them to pass on the note so he could see a specialist, you know, give the approval for that. And in 2 months' time, they still had yet to do that. And once he does see a specialist, it's going to take months before he can even see a doctor. And so this is one small area. I know that this is happening everywhere.
Um,
And our seniors, they don't always have the patience. My father feels like he's running out of time. And so he said, I'm not doing it. I'm not going to play this game. He thinks it's a game. He's like, I'm not going to buy into this. I'm just not going to see a doctor, which is so sad. You know,
Absolutely.
what are we going to do? How are we going to help
And
them?
during that time, it could be spreading, it could be life-threatening. There could be all sorts of issues that if it were identified quickly and treated for quickly, his outcome would be different. And what you
Absolutely.
described, Athena, is happening all over America. We just don't have and that even goes beyond the issue of the geriatricians. We just don't have the medical professions in place, and certainly not in urban areas, because in urban areas like where we live, to get a new neurologist or to get a new psychiatrist for an older adult, it could be up to a 6, 10, 12 month wait, because we don't have specialists moving into the urban areas because it's so costly to live here.
Yeah.
So we're losing out on specialists coming into our area to treat people.
Yeah. And, you know, I feel like this is kind of almost transitioning to why it's so important to have certain people in place to advocate for you if you're a senior, like yourself, geriatric care managers, people who are there to really manage and help the senior with their health care, with all their needs. Can you tell me a little bit about that? And like, what does that look like? And what are some of the challenges that you face in your industry with taking care of your patients, or your clients? And how does that work? Is there any conflicts with adult children in that regard?
Well, conflicts within the family, yes, there's always, every family's different and there's going to be differences of opinions. So I'll take that aside and just talk about navigating the healthcare system
Yeah.
and how important it is to have an advocate. And if you're an adult child listening to this, I suggest really strongly to start a medical notebook of each one of your parents with their medications, their dosage. And why is that? What is that medication for? Is it a Lasix? Is it cognitive? Is it a mood disorder? Know what these medications are and the side effects and the interaction. It's important to be able to understand that getting a referral, you have to do more than just get that referral. You have to advocate. You have to advocate to get that appointment. And when you go to that appointment, you have to come prepared with your questions written down in your medical notebook so that as the adult child, you can have an ongoing dialogue so that every time you go to the doctor, you can look at your notes from the previous appointment. And that's kind of where someone like me comes in as a geriatric care manager, especially for children who live out of state or even 60 miles away. It's really important to have somebody else go to that doctor's appointment. You just can't send a 74-year-old person to a doctor's appointment. We as adults ourselves only maintain about 9% of what a doctor's telling us when we're at the doctor's office because our brain is just overthinking, trying to think of the next question. So it's really important to have another body there to listen to what the doctor's saying.
Yeah.
And then it's also important when you stay on the healthcare, the medication management to make sure that our people are taking their medication correctly. And some of the technology that we have now, we can get medication reminder dispensers that can be hooked. I have a client that is in Switzerland who I do the medication management for his parents here in Walnut Creek, but he's hooked up in Switzerland and can tell me if there's something going wrong. So there's all kinds of technology that we need to embrace to help us navigate for our parents so that they can remain safely living in their environment.
Absolutely. And I love that. I love the medication management piece, such a huge piece. I mean, later on in Spotlight, we'll even talk to pharmacists who have started to transition their career into helping seniors really manage their medication and assess what it is that they truly do need. Because again, going back to that healthcare system, sometimes they're not all talking to each other. There's definitely flaws. We have flaws in our system, right? And so there's a lot of things that we need to be careful, we need to watch out for. Having a geriatric care manager, I think personally is really important. I mean, again, my father's in Hawaii, I'm in California. I can't help him from over
Right,
here.
exactly.
And so that really is a valid point, even in our senior living communities. We know we heavily rely on geriatric care managers to help our residents who don't have family here, who aren't really mentally able to take care of themselves cognitively. They just can't do all the things that they need to do. They need some support. And
And an
even
advocate.
and an advocate, absolutely, because in certain areas, it is hard, like you said, to have appointments, to follow up, just to do the things that we don't naturally think about. But someone like yourself is an expert and you know those next steps. So this is really important. Is there anything that you can think of as we have, we're working with seniors and you see in all that you've been doing for so many years, can you see kind of where we're heading as we age, health wise, mental health wise, physically, all the things, and things that we can do as we're younger or today to start to take care of our bodies and start to take care of our mental health so that as we age, we're aging well.
Yep, yep. Well, one thing is we spend more time planning a vacation than we do planning our retirement and the second part, the third part of our life. I mean, just think about it. We're all guilty of it. We know how we're going to go, what we're going to do, who we're going to see when we're on a vacation, but do we know what we're going to do? What does our retirement look like? What does 65 and over look like? So as a young person, um, I would highly recommend that one investigates long-term care insurance to see if it's something that fits into your budget now,
Mhm.
when you can get rates that are realistic, and because at every age, every year it becomes more expensive. Because right now, and I'm going to quote for California urban area, but we're all most likely going to need some kind of in-home support, some kind of caregiver to come in to help us, even if it's only a couple hours a day.
Mhm.
That's looking at $40 an hour, $40 to $48 an hour. So you can do the math. That adds up really, really quickly. So we need to start planning for that. We need to have those conversations. As parents, as adults of aging parents, we need to know what their financial picture is. I can't tell you how many clients I start out with, and their children absolutely do not have a clue as to their finances. And we need to plan for the future. We need to make sure, because Medicare and Medicaid do not cover what we need to cover for our living. It's only a piece of the financial documents. We also need to make sure that we have our living trust or our will in place. We need to make sure that we have a healthcare directive so that if somebody has an emergency and goes to the hospital and they don't want to have the they need to understand what do not resuscitate is.
Yep.
We need to talk about what is a feeding tube. We need to talk about what it is, artificial breathing. If we have CPR and somebody crashes our ribs because they're reviving us, we're going to live in pain. I mean, is that what we want? Is that what our parents want? We need to have those conversations now rather than when it's a crisis. And
Yeah.
then cognitively, we need to stay socially connected. We need to challenge our brain. As an older person, it's wonderful that we're doing puzzles, that we're staying socially connected. The internet has brought us all kinds of opportunities to stay socially connected, as a older adult, and then also as an aging 65 and over person. We need to take care of ourselves health-wise. We need to eat nutritionally balanced meals. Hydration is huge. When an older person gets a UTI, a lot of
Mhm.
times it's due to lack of hydration. And a UTI does havoc to a person's body.
Yep.
You think they're dying, but you get on antibiotics, and 24 hours later, you're back up and getting better. But we need to exercise. We need to not be couch potatoes. We need to, and the internet has brought us opportunities to engage in exercise groups on the internet. So there's no reason that I can't get to my senior center to do a fitness group. We can join things on the internet. And as I say that, then we have to think about transportation. Where
Mhm.
we age, is there transportation? How am I going to get to the doctor's appointments? What kind of resources are
Yeah.
available to me in the community to transport me to these socialization places like a senior center or senior legal services or that type of thing?
Yeah, so many important factors to consider that you just named. And I want our audience to think about their community because I know in our community, we have a ton of different resources. We do have lots of senior centers around us. We have transportation services. Mobility Matters is one of them. We have options to help us, our seniors, with food, like Chefs for Seniors. There's just so many different resources. We also have senior living communities like the Kensington and Byron Park. So if you have a senior that doesn't want to be in their home because it's no longer safe or it's no longer an option, or they want that social engagement, a senior community is a very good choice. So we
Absolutely.
have a ton of resources, but not everybody does. And maybe some people are in communities where they think they don't, but they actually do. So
Yep.
it should be the professional that is serving the senior, whether it's home care, it's geriatric care management, it's your fiduciary, whoever is supporting you. That person should be the one to help you find these resources. And also, if we're children that have parents that are aging, it is our duty to help our parents to find the local resources available to them because there are so many available to them. I know, Lorna, you mentioned that you're on like different councils and boards and things. Can you kind of go over a couple of them that are nationwide where people could access and tap into some of the resources that you are familiar with?
Yeah, absolutely. What we talk about today, we have to realize that we're in a government that is evolving right now. So what I tell
Yeah.
you today may not be real tomorrow. But we have what's called the Older Americans Act, and that was established in 1965. And through that, federal funding comes into all states, all communities, rural or urban. And the money through the Older Americans Act provides services such as transportation. It provides Meals on Wheels. It provides congregate meals, congregate dining. It also provides social service programs. It provides respite care, legal services. But in order to access those services, the thing that get your pencil ready because this is called the Elder Care Locator, okay? And it's federally funded by the Community on Living. And the phone number is 1-800-677-1116. And you call that phone, there's also a website, but you call that phone number and they will direct you to your local area agency on aging. Okay, AAA, like the AAA, Area Agency on Aging. And that the money comes from the federal government, it comes to the state departments of aging or whatever health, whatever department within your state it's located, and then it's funneled out to the area agencies on aging. In California, we have over 32 agencies. Those agencies are where you need to connect with because they're going to give you, they're funded to give you information and referral. You can call them, they'll tell you, you ask them what your question is, where's the senior center, transportation services, legal services, social services. All of those services that are federally funded are going to be available through the AAA, and they're going to tell you what it is you're looking for. So that's really, really a good place to start. Another place to start is we forget AARP. They have fabulous videos, right down to changing a sheet while your loved one is bedbound in bed, how you do it, and step by step. So that, we have resources there. We just need to know where to look for them. As a family caregiver, and I'm not going to give you statistics, but it's huge the amount of family caregivers we have taking care of our unpaid family caregivers, taking care of our loved ones. And there is a national organization called the Family Caregiver Alliance. And I'll give you that phone number too. I don't have it memorized, so I have to read it. 1-800-445-8106. And that's throughout the country. And they also have videos and programs. So those are some national places where you can start your research. Because there are services available throughout our nation. There are not enough services, but there's a place to start. That's a starting point.
I love that. So many different resources. Um, Again, even in rural areas, there's still resources available to you. You don't have to be in urban or metro areas. You can be in those smaller communities and still access and tap into these federally
Mhm.
funded resources. So thank you for naming some of those, Lorna.
Yeah.
I know that you have, again, like all this experience. Are there particular different professionals that you would say if there's an adult child listening to this podcast today and their parent is aging, are there specific resources that you say you absolutely need to make sure you have this in line? I mean, we've talked about a trust, really important.
Mhm.
Fiduciaries, in some cases, I think they're important depending on the family dynamics. And then possibly
Healthcare directive.
healthcare directive.
And
Yes.
everyone age 18 should
Hmm.
have a healthcare directive. And that healthcare directive should be looked at every 10 years because you might not even like that person 10 years from now. But a healthcare directive is very important so that, in terms of, again, having that conversation, what does it look like? How does your parent want to age? How do they want to be buried? Do they want to be cremated? Do we know the answers to these questions? We need to have those conversations. And we need to also make sure that we have our finances in place in terms of power of attorney, so that if there is an unexpected crisis, that the bills can continue to be paid because one child is a POA on the checking account, so that the mortgage can continue to be paid, or the PG&E, or that kind of thing. I can't tell you how many clients I have that have no children. They never had children. So now we're looking at a whole nother diverse group of people. Their needs are still the same.
Yeah, absolutely. And again, going back to the very start of our conversation, there is an aging population, and we need to look at this. It's the numbers are just phenomenal when you see
Staggering.
the percentage of how much what our population is looking like as we're aging versus those that are younger. And so this is something that we need to look at, we need to address and really pay attention to. When I think of seniors and I think of our aging adults, I think of so many different topics because I am in the industry. Lorna's in the industry. But as you're listening today, hopefully you're realizing like, wow, there's so much more to aging than I ever thought of. And that's the whole point of Spotlight, right? It's bringing light to the topics and the different scenarios of aging that we may not think about all the time. So really important stuff. Lorna, you have been phenomenal today and brought so much enlightenment on some of the topics that really are important and just vital to the aging process. And I would like to know, how could our audience get a hold of you if they wanted to talk to you more about maybe their loved one or themselves, if it's them that they're thinking of, or even if it's a professional who's listening and thinking, well, my patient or my client really needs support and I need more information. How can our audience get in touch with you?
Well, they can get in touch with me. My company that I founded is called Aging Care Concierge, and my website is agingconcierge.net. And my personal email for the company is Lorna V Cares, LornaVcares @gmail.com. And then my phone number is 925-367-9002. People throughout the community can go on and do a Google search for geriatric care managers. We, like geriatricians, are few and far between,
Mhm.
but somebody like me who knows local resources and also national resources, I do consult with families outside of my network, my community. I have a very big clientele of families, children that live out of state, but want eyes on their parents here in Contra Costa County. But you can go online and search for geriatric care managers. You want to make sure that you get a certified geriatric care manager because that means that we've gone through training, that there's a whole ethical oath that we take, that we're certified. So I would definitely suggest that if you're going to look at care management, that you get a certified geriatric care manager. And
Absolutely.
then, yeah, and then, just be ready to ask the questions. And usually, a qualified care manager is going to be asking questions to get more information from you to really get a picture of what the needs are and what the person's looking for.
Thank you for sharing that. You beat me to the punch. I was going to ask, what are some of the things that we should be looking out for with geriatric care managers? So, yes, a certified
Yep.
GCM, really important, because there are people who go out and they just kind of label themselves, or they
Mhm.
work under a larger umbrella and they're not really trained in the ways that we want our professionals to be trained in. So look for that certification. And Lorna, you have been just phenomenal today. You've shared a wealth of
Thank you.
information. So thank you so much. I appreciate you being our very first guest and just for shedding light on the senior industry.
Absolutely. Thank you for inviting me, Athena. I appreciate it.